Welcome to the Carter Center's first Google Hangout. Today we will release the provisional 2012 guinea worm numbers.
Good morning, everyone. Good afternoon to Juba. When we started the guinea worm eradication program now many years ago, I could not have imagined that we would be using this kind of technology.
Well, we started working on guinea worm back in 1986. A total of 3.5 million cases that we identified to begin with. In about 25,000 villages, we've been in all those villages. Either we or the people we've trained, and we've cut it down from 3.5 million to just 542 cases in 2012.
521 of those, or 96%, were reported from South Sudan so far.
We're going to go ahead and move into the Q&A portion of today's event. We're going to start with Christina from the Associated Press. Go ahead, Christina.
What do you see as the biggest remaining obstacle to eradication?
I would say that the main obstacles that we face now are the fact that just one case of guinea worm in a village, if not addressed quickly, can be spread to maybe 50 or maybe several hundred cases the following year. So we not only have to do away with the disease in a country, but we have to monitor that country for a number of years afterwards just to make sure that there's no undetected case that can come back and spread the disease again.
Which areas specifically in South Sudan are the worst affected? What implications do you think the recent austerity measures could have had on, health service provision, in this case, specific focus on guinea worm eradication?
Guinea worms are cornered in the very easternmost part of eastern Equatorial states.
Since May of 2012, a very important bridge has been broken down. That has increased the cost and caused delays in being able to transport material, not just for the guinea worm program, but for others, to other parts of that very important county, which, as Ernesto said, has over 80% of the diseases remaining. So that's the only one area I would point to. Otherwise, the program has not suffered, to my knowledge, from the austerity measures.
I was wondering if you could talk a little bit more about how exactly you're going about this eradication and to what extent the local population is involved.
We need to find any person that has guinea worm and immediately keep that person from going back into the water hole where everybody gets their water. So we contain them or isolate them and teach them the problem and make sure they don't spread the disease further. That's a very important element of what we do to prevent the spread and to continue our progress.
I would also add that an important element of this as well is support from the national government.
In addition to that, we have about 12,000 volunteers that are monitoring all these communities that are not paid by us, and they're doing the work just because, not to please the Carter Center or to please a former president, but to keep this disease away from their children. We distributed about 9 million of these to people when we couldn't even get there. And the people would wear them around their neck like this, and then when they got ready to drink a drink of water, they would just suck it through the little filter on the end, and they could prevent having a guinea worm. So we are depending to some degree on the fact that the people themselves are the ones that are most interested in doing away with guinea worm.
Thank you, President Carter, and thank you, Dr. Hopkins and Dr. Ernesto Ruiz-Tiben. I want to thank the journalists for participating and all the viewers for joining us online to follow the historic guinea worm campaign and our journey to zero cases. And thank you and have a great day.